So I'm going to start recording this, and we're going to have to deal with some weird issues here with, this will be in a separate window. Okay, default. There we go. And boom. That's not working. Okay. We're going to have to do this again. Great. Okay. So today I'm going to be talking a little bit about how we've used one of our systems to shed light on aspects of human behavior that are relevant to these models. And this is in the context of these complex health challenges of which I've spoken. The challenge here is that we're increasingly using rich decision-oriented simulation models, models that involve positing aspects of the causal structure of a system. Perhaps it's about people's, perhaps we're interested in understanding the impacts that in regulating e-cigarettes and interested in knowing what are the most effective regulatory schemes for e-cigarettes. And to do that, we want to build a simulation model which captures sort of the ecology of smoking, which, as James Koopman noted, of Michigan noted 10 or 15 years ago, it's a contagious disease, smoking. It involves communication of behaviors, attitudes, norms from one person to another, in particular between smokers. There's social support networks built around smoking. Uptake, initiation of smoking is known to be affected by social context, peer effects, peer pressure, and relapse is likely affected by similar phenomena. So we might build a simulation model to help us understand smoking. We might be interested in the effects of physical activity interventions or changing the built environment and its impact on obesity or diabetes rates. And to do that, we might build a simulation model where we have people within the model who undergo patterns of sedentary behavior, who undergo bouts of physical activity, and who are affected by the environment in which they're situated in the model in order to understand how their obesity levels and their risk of certain chronic diseases are affected more distally by the aspects of that environment. And simulation models like this, if you go out and you find them, they're out there. Some wonderful work done by Anna Dié-Roux on, for example, on the effects of neighborhood walkability on people's physical activity patterns. But these models, ladies and gentlemen, these models are often very fine-grained in their depiction. They're depicting the little bouts of physical activity and sedentary behavior of a person during the day. They're depicting the uses of nicotine products, regular cigarettes, e-cigarettes, perhaps e-cigarettes for indoor smoking, outdoors using regular cigarettes on the part of individuals. And the challenge here is that when we're building these increasingly rich and fine-grained simulation models, to really tie them down in a way that will give quantitative trade-offs and insight between different types of interventions, often we need fairly detailed information on, for example, individual trajectories and aspects of individual behavior over time. And a key challenge here is that behavior on many of the relevant factors, including components such as location, physical activity, people's proximity to each other, their social context, their communicational behavior, decision-making rules and heuristics, is not well characterized by the literature. It's not well characterized by traditional survey instruments. So, in the States, you have large-scale cross-sectional survey instruments like National Health Interview Survey, or longitudinal ones like the National Health and Nutrition Examination Survey. In Canada, with the CCHS and MPHS, which are broadly comparable, but at a smaller scale. And I'm sure Australia has similar survey instruments. But people's self-report for physical activity is known to be highly suspect. People's reports of how much time they spend playing rugby or how much time they've spent with field hockey. You folks don't have curling or ice hockey as much here. But those things tend to be poor recollections on the part of people. There may even be confabulation. Similarly, people's recollection of aspects of their dietary use, of what they ate over the past month, is pretty sketchy. Aspects of who they've been near, how much time they've spent near people, even where they've been, although it's increasingly tapped for contact tracing. If you really look at differences between what people say in terms of how they spent their time and what's actually recorded, there's often big disparities in place. And the problem is that absent understanding of behavior that involves these components, involves where people spend the time and the physical activity with which they're presented, their proximity to other individuals and their interactions with others. Without that, the model's accuracy is compromised, and we do lose some potential to quantitatively evaluate policy trade-offs. There is the risk that with a detailed model, without the requisite theory or empirical data to back it, you may have to be engaged in a lot of speculation, which is not going to tie it down enough to allow you to have reliable results to assess interventions. So, for example, some of our partners at Columbia University in the city of New York were really interested in understanding the effects of housing interventions. So if we move someone from a low-income neighborhood to a mixed-income neighborhood, what are the likely effects? And the data that were available were very granular. They were very coarse-grained. They had information on obesity levels, that in teenage girls, the obesity rates were lowered. And similarly, in those girls, crime activity was lowered, and high school graduation rates were improved. Interestingly, in boys, there was no effect in two of these, and risk of criminal activity actually went up. And there was a lot of hypotheses put forward about why this might be. Perhaps it's because in the neighborhoods with safer streets, the girls are able to go out walking more, and there's better sidewalks, and they're able to exercise more each day. But so maybe it's through physical activity, but maybe it's through sedentary behavior. Maybe it's not so much that they're engaged in use of recreational resources like parks and ball courts for high vigorous physical activity. They're just up and about longer. Maybe it has something to do with the healthiness of the diet and the fact that these new neighborhoods have much better access to grocery stores, much better access to fresh fruits and vegetables, and not just convenience stores. But maybe it has something to do with the fact that in this new neighborhood, the girls are spending more time at home. And they're eating at home more rather than out with buddies because their social networks have been disrupted. And eating at home with mom's good cooking, they actually have access to a healthier food environment. A lot of hypotheses put forward, not a lot of evidence to bring to bear for this. For situations like this, we've increasingly turned to electronic data sources. And I think I have about 10 minutes to sort of talk about this. So I'm just going to give you a brief glimpse about some of the ways that these sources can bring insight and can leverage models. The observation has been, it was made by Don earlier, today's devices, consumer electronic devices, the iPhone or Android phones, Android tablets, smartwatches, they're remarkable devices for the functionality that they offer. And people have snapped them up because they can hold chats, they can record things on them, they can use them to put on makeup, all sorts of different activities. What's less widely recognized is that a large fraction of those activities are made possible by the fact that they're chock-a-block full of sensors. These devices are just filled with sensors, and the sort of realization here is that these sensors can be repurposed at little or no cost to their original function for other use, and particularly to give insight into health behavior. We're also increasingly exposed to a cacophony of wireless signals. All around us, there's GPRS, GSM, Bluetooth, Wi-Fi signals, and potentially a variety of others and other protocols that are zapping around us for common operational use. It turns out that the occurrence of these signals and their signal strength can be used to give a huge amount of indication about where we are, with whom we're located, and to some degree what we're doing. So based on this, starting about 6 years ago, and through strong contributions of a broad team, we invested in building a smartphone-based data collection system for health that would be designed to be extremely broad in a set of health behaviors it could collect. It would combine together a sensing platform with a rich survey platform for microsurveys on the device, surveys that can be triggered by context, and it would be based on commodity devices that people would carry for other reasons because they're very attractive devices. We would provide it in a way that would guarantee really rigorous levels of security for private data, to the point where if I grabbed one of these devices and went off and nerded on it, I couldn't break its security for several months. And we wanted to combine these devices with analytic technologies, including dynamic models, that could provide insight into the implications for decision making. So this is a smartphone-based device that opportunistically uploads data to a set of servers, or to a server, where there's a set of analysis technologies on the server which can be used to make sense of that data, which otherwise is a cacophony of numbers. So we have this secure opportunistic backhaul that can use Wi-Fi or cell connections, or as a fallback, sort of manual offloading of data from these phones. So fundamentally, people can be equipped with these phones. Increasingly, we have a version of this can be downloaded to people for use on existing phones from Google Play Store. And we are looking increasingly to draw it on people's own smartphones, but traditionally we've handed them out. And these are some of the key areas addressed. And you'll recognize these from a previous slide because they're the ones I said are really hard to measure traditionally reliably. And what's really notable is that we can pick these things up with very low burden to people. We can pick up aspects of their location, their physical activity, aspects of their spatial proximity with respect to resources, including to other participants, their social context, and their communicational behavior. So these smartphones provide a very convenient platform for picking this information up and for asking time and context-specific questionnaires that can ask questions of interest to a particular study. Now, this system is designed to be extremely flexible, to be reconfigured with minimal programming. There's a little bit for changing the interface, but in terms of changing the questions or how frequently they're offered or what data you collect and how frequently you collect it, all of that can be reconfigured on the fly during a study if required using the smartphone. So we can pick up micro contact data between people, capturing changing networks over time, the durations people spend with each other, accelerometer values. We can capture where people move in space, the differential patterns seen for people who live in different neighborhoods with respect to exposures to certain resources, like food stores, like larger grocery stores compared to convenience stores. We can look at their activity spaces through the day and see what resources they're brought into close proximity, rather than just looking at their home address as a crude proxy. We can capture information about where they are within a structure, even within a building, and we can support studies, and we've done a number of these now, where we use buttons on the device to indicate, so the participant can proactively report certain things. In this case, this is a study we're running with Dana-Farber, Harvard, and American Legacy Foundation for reporting exposure to tobacco-related messaging. Or you could do this for exposure to advertising for fast food, or when you're taking your medication, et cetera. So we have these sort of study-specific interface that can include custom buttons, custom display regions, a sampling regimen, and questionnaires which can be specified. And for most of it, the questionnaires and the sampling regimen can be updated during the study. So we can have buttons that indicate these sort of mechanisms. And here's an example of a questionnaire that pops up. You'll hear my tablet go off sometimes. It says, "I have a question to answer," and it'll pop up. So we can use this to give these sort of micro surveys to people during the day to inquire about aspects of their behavior that are not evident from the sensing and are not self-reported directly. We've combined these things with weight scales, with a photo food diary. Someone in another lab, Regan Mendrick's lab in our department, has combined it with EEGs to measure people's brainwave activity, to capture aspects of attention, et cetera. There's a number of other technologies, say, for localizing it indoors. So we can pick up a wide variety of components with a system like this, and what's really valuable is when we can cross-link this. We can cross-link data about activity with space, for example, to find out where spatial physical activity is taking place in space, or capture where people's social contacts take place in the course of a day, the spaces in which they're encountering other participants and other non-participants as recognized by other phones in the area. We can look at, we could cross-link it with weather reports, GIS databases on availability of certain resources like parks or areas where there's walkability or crime issues, and we can use it to recognize exposure to resources. Key constraint for all of this is energy. There's limited energy on the devices, but fortunately devices are becoming more energy efficient. So one of the key benefits from this is to use a system like this to delineate the pathways to explain outcomes, particularly outcomes for interventions. I talked earlier about the uncertainty about the particular pathways by which housing interventions affected outcomes, or by which tobacco messaging, for example, affects people's tobacco use behavior. Are the prevalences of smoking lower after the intervention, predominantly because lack of uptake or better cessation or lower relapse rates? These are things that we can delineate with this finer grained behavior. And that sort of information comes to dock very, very closely with what's needed for models. And we have a hierarchy of models we can use to analyze data like this, including statistical models drawn from machine learning, computational stats, such as hidden Markov models. But a key component of this is decision-oriented simulation models. And fundamentally, the two complement each other extremely well. Simulation models can help us turn the insights from this big data into actionable results to understand the implications for decision-making. And the big data side can ground the models in ways that would otherwise lead to speculation. So we have big data here that's tying down model parameters, that's giving us data against which to calibrate a model, to compare the model, or against which to validate it by means of rich empirical data about underobserved behavioral patterns. But I think most importantly, at a high level, what I see the key benefit as being is in the context of interventions. When you have interventions in place, regardless of whether the intervention is successful or not successful, you want to be able to learn from that experience, elicit the greatest understanding, the greatest learning from that experience possible. A simulation model can help you understand what you might anticipate, but sometimes you find divergences between what's observed and what the simulation expects. Or you find the intervention overall simply had almost no effect. And technologies like this can help us figure out why it had no effect, which pathways were nudged, which pathways were not nudged. For example, was this certain intervention aimed at physical activity not so successful in lowering waistlines, predominantly because it didn't change physical activity levels, or maybe it did change the actual physical activity, but it also increased dietary intake, or it increased sedentary behavior, and so it canceled out some of the effects. By allowing us to sort of learn in greater clarity which pathways are being exercised and being changed by an intervention and which are not, we can better learn from that intervention experience and design interventions that take into account some of those failings, some of those areas where the intervention fell short, and be able to more quickly learn from that experience. Rather than just being a failure, it's an opportunity for great learning. So in short here, I've given just a glimpse of this. Later, deeper discussion will have to wait till later in the week. But the picture here is sensors are increasingly ubiquitous, and commodity sensor-bearing devices can serve as really rich platforms to give insight into health behavior. We can use communicational technologies to situate where we are and who's nearby us, for example. And when coupled with models, this data can offer really complementary health insights and can tie down models that otherwise would involve a lot of speculation. So, sensor-based data here can really complement traditional data sources and help us build more effective models in which we have a greater degree of confidence. Big data can enhance the insightfulness, timeliness, and reliability of traditional techniques such as surveys as well as of models. And doing this is increasingly open up to researchers in the rank and file, not to simply large statistical agencies like our Statistics Canada, corresponding Centers for Health Statistics in the States, or corresponding agencies here in Canada. So this is a bit of a glimpse of an element of big data. And if people are interested later in the week, we could look at actual models where components have been directly informed by this data and where social networks, for example, in the model are driven by data collected by these devices. Okay, so that's all we have time for now, and I'll transition to the next speaker.
Thank you.
Very good.